Hello, hey, I'm Rohit Budhiraja, one of the sleep doctors at Brigham and Women's Hospital, and today we will talk about Respironics recall. Remember, it's general information and not specific information about your case. So today we will talk about reason for the recall, what symptoms can you get from Respironics machines, how common is this issue, should you stop using your CPAP? What if you want to continue your CPAP? And what are the alternative treatment options for sleep apnea? So first of all, a lot of CPAP machines, they use this insulating foam. And it seems like some particles of the foam can break down and they can be inhaled or even ingested. Philips has received some complaints regarding presence of black particles within the humidifier or the tubing or the mask, which led to this issue. Philips has also warned that there may be some chemical emissions, some toxic gases which may emanate from the CPAP machine. However, Philips says it has not received any reports of patient impact or serious harm from this issue. Now, what are the symptoms if you do inhale those foam particles? Headaches, cough, chest pressure, sinus infections, skin irritation, eye irritation, upper airway irritation, all of those symptoms can happen. But remember, these symptoms are not common. When Respironics did some investigation, they found that this is happening in less than 1 in 3,000 people. So it's very, very rare. Philips says that there is a possibility of cancer and toxic effects, but they have not released any information about the risk of such issues. And it seems like the risk of these issues is low, depending on what they've been telling us. Now, the risk of problems with the foam degradation, that's higher in people who've been using one of those ozone CPAP cleaning devices. And ozone seems to break down the foam a little bit faster. Again, the foam is breaking down into small particles. Respironics says that those particles are not small enough to penetrate deep into the lung. So when particles penetrate deep into the lung, that's when they can cause significant lung injury. With particles being a little bit bigger in size, the risk of that issue is lower. So what should you do if you have one of those CPAP Respironics devices, which includes a lot of CPAP machines, a lot of BiPAP machines, some ventilators. So if your CPAP or BiPAP or ventilator says Philips Respironics, call your DME company. So Philips is working with DME companies. That's the company which gave you your CPAP. That's the company which frequently gives you your supplies. So Philips is directly working with DME companies to repair or replace your machine. And usually the DME companies would have their phone number on the machine, so you can look up that phone number and give them a call. Or you can go directly to Philips website and register there, so you will be put on the list for your device to be repaired or replaced. Frankly, at this time, we have no idea how long it will take. Now just imagine there are over 4 million people in the country who are using Philips Respironics machines. So it seems like it may take several weeks or months or maybe a year or more for that to happen. Now, when you call your DME company, if you have severe sleep apnea, let them know. If you cannot sleep without your CPAP, let them know. And if you have been using ozone machines for cleaning your CPAP, definitely let them know, because you might be put on a higher priority for replacement or repair. Now, a lot of people will call us asking, should they stop using the CPAP machines? So that's exactly what Respironics is recommending, that people stop using their CPAP machines. The problem is sleep apnea itself can cause significant complications. So one side, there's a small risk of problems if you continue to use CPAP machine, less than 1 in 3,000 from what we've been told. And on the other hand, other complications from sleep apnea. So you have to judge which complication would be worse. Now remember, the complications from stopping the machine might be higher if you have severe sleep apnea. Or if not using CPAP makes you sleepy in the daytime, the risk of traffic accident goes up. You won't be able to do your work properly if you're sleepy. In all those conditions, I'd say you should probably continue using your CPAP machine. And if you have significant other symptoms like headaches or other issues, and you're worried that stopping CPAP will bring those problems back. I mean, if those symptoms resolve with CPAP, and you're worried that stopping CPAP will cause those issues to come back again, then of course you should continue with the machine. And then if you have conditions like uncontrolled blood pressure or uncontrolled blood sugars or angina, chest pains, a lot of those issues can be worsened by sleep apnea. In that case, stopping CPAP machines, that will have its own complications. And of course, if your machine is a life-sustaining device, sometimes people are put on Respironics ventilators because they cannot breathe without that. Of course, you will have to continue using your machine in that case. So a lot of conditions where people should probably continue using their device, despite Respironics saying that you should stop it. Now, what if you do want to continue using your device? First of all, you should be cleaning it manually on a regular basis. Do not use any of those machines to clean your device. Call your DME company or download the manual for the machine if you don't remember how to clean the device. Second is, do not expose your device to high heat or humidity environments. Of course, if you live in a place like Arizona, which can get pretty hot, do not leave your CPAP in a place where it would be exposed to high heat. Now remember, the heat or humidity from the humidifier in the CPAP, that does not impact foam degradation. It's the environmental heat or humidity. So if you need humidity, if you need heat while using CPAP from the machine, definitely you can continue using that, but do not expose your machine to high heat or high humidity environments. And of course, if you're using the machine, those foam particles can appear as small black particles. They can appear in the tubing, they can appear in the humidifier or in the mask. If you see those things, stop using your machine right away. And of course, if you start having a new headache, new cough, new difficulty breathing using the machine, something which you never had, then of course, stop using the machine, call your doctor right away. I mean, of course, the weather is changing. A lot of people will have regular allergies. So if your symptoms seem like regular symptoms and they go away soon, then you don't have to call your doctor or stop using your CPAP machine. But again, if there are new symptoms or they persist, definitely you should be calling and stopping your machine right away. So one thing you can do at this time is wait for Philips Respironics to replace or repair your device. But what if you do not want to wait for that to happen, since it can take a long time? So it's a possibility that your insurance might approve a new device, especially if it's over 5 years old. So first thing you want to do is call your insurance and ask them if you would be eligible for a new device. And of course, if you got CPAP maybe a couple of years ago and 3 months ago you got a new insurance, you might be eligible for getting a new device through your new insurance. So definitely give them a call, give your DME company a call, and you might be able to get a new CPAP sooner. And the other thing, of course, you can do is, if you can afford that, paying for a CPAP machine out of pocket, which some people are doing at this time. Of course, not everyone can afford that. In that case, talk to your DME company and ask them to put you on a list for repair or replacement.